Well, I think it's been a very important year for targeted therapies in hepatobiliary cancers. First, when you think about hepatocellular carcinoma, we started in an era of sorafenib and sorafenib alone. And in the last 3 to 5 years, it has been rapid fire in terms of FDA approved drugs available to our patients. But I will say that in the last year, the IMbrave data with atezolizumab and bevacizumab has just kind of blown everything out of the water in such a great way. Atezolizumab is obviously an immunotherapy, and it's used in combination with bevacizumab, which is a monoclonal antibody targeting the VEGF pathway. And this data was initially presented at ESMO Asia and has since been published. We are seeing updated survival data coming out of GI ASCO this year. And it's not one of those Kaplan-Meier overall survival curves where you need a magnifying glass. It's a very obvious separation in terms of survival between sorafenib and the atezolizumab and bevacizumab arm. And it has completely changed the treatment paradigm for HCC. It is FDA approved, and it is a regimen that most people are starting to get comfortable with and understand how to give. I think the areas of interest really are, what do we do after? How do we sequence the other drugs that we have available to us? Is there utility for immunotherapy after atezo and bev? So that's really kind of the landmark study that came out and that we are excited about. There's, of course, a number of other frontline studies that we're awaiting readouts on that include the durvalumab study with or without tremelimumab, the study with cabozantinib and atezolizumab, the study with lenvatinib and pembrolizumab. So there's a lot of combination studies that everyone has their eyes on that hopefully should be reading out soon. Those are combinations of targeted therapies with immunotherapy. And then in the biliary space, the main FDA approval we had, which was sadly the first FDA drug approved for cholangiocarcinoma, and therefore it was a really landmark moment, was in April of 2020, the FDA approved pemigatinib, which is an oral FGFR inhibitor that targets those patients with FGFR2 fusion positive cholangiocarcinoma. So it's approved for these patients with advanced disease after upfront therapy. And this was a very big deal. First of all, because it was a targeted therapy that was approved. Second of all, because like I said, outside of gemcitabine and cisplatin, there has not been a real clear standard of care treatment that everybody kind of has access to. And the PEMI data was presented, the FIGHT 202 data was presented at ESMO in 2019 and subsequently published. And it's a robust data set of over 100 patients with FGFR2 fusion positive cholangiocarcinoma. And importantly, infigratinib has also filed for FDA approval based on the updated data they're presenting at GI ASCO, which again is an FGFR2 fusion positive cholangiocarcinoma after upfront therapy. So it'll be interesting if that gets approved. We will have a couple choices in terms of FGFR inhibition for these 10 to 15% of patients that have the FGFR2 fusion.